What's wrong with you? What do you have? You're crazy?
I'm not crazy.
You're crazy.
No, I'm not crazy. No.
Doctor,
No.
we have a patient here.
What the hell?
A child.
No.
I don't know what the fuck is happening to him.
No, I'm not crazy. Calm down. Hey.
Maybe she's crazy.
Nurse.
Natalia, calm down. Calm down,
I'm not
please.
crazy.
Natalia, calm down.
Oh my God. No. I'm not crazy. Calm down, calm down. No, I don't want to leave anymore. I promise everything's gonna be okay. You promise? Yeah. We are going to operate you and we are going to. No, you are not crazy. You are going to be okay. Calm down, calm down.
Schizophrenia is a disease that affects the brain. It alters brain chemistry and brain form to produce a different behavior in those afflicted with the problem. It appears that these alterations change in inherent eye function in each individual. Loss of important functions associated with this piece of the brain nervous system box is found in these people. The doctor decides upon a diagnosis by evaluating symptoms that are present. Also important in diagnosis is the individual's medical history, family medical history, use of substances such as alcohol, cocaine, heroin, or other street drugs, response to the medication prescribed to relieve symptoms of schizophrenia. The symptoms are hallucinations. These are experiences in which any one or more of the person's five senses play tricks on him or her, giving misinformation. Most common hallucination, hearing voices that no one else hears. The solutions. There are false beliefs, firmly held by ill person but which other people do not believe. Examples of the solutions. Someone ordinary convinced that he is a great singer or someone convinced that she is being drugged by others who intend to harm her. Disorganized speech. The in-person speech is hard to follow or the person can't stay on topic when talking. Extremely confused, disorganized, or withdrawn behavior. Negative symptoms. Face shows no expression. When talking, the person does not give much information. The person has problems being motivated to do things. In the past decade indicates that schizophrenia is due to a genetic predisposition and environmental stressor early in a child's development, during pregnancy and birth, and or early childhood, which lead to subtle alteration in the brain that make a person susceptible to developing schizophrenia. Additional environmental factors and stressors later in life, during childhood, adolescence, and young adulthood, can either damage the already vulnerable brain further and trigger schizophrenia or lessen the expression of neurodevelopmental defects and decrease the risk of schizophrenia. In fact, experts now say that schizophrenia and all other mental illness is caused by the combination of biological, psychological, and social factors, and this understanding of mental illness is called the biopsychosocial model. Population, for someone who has no family history of mental illness, the average risk is estimated at approximately 1%, and therefore a 99% probability that the person will not get schizophrenia. If someone who is genetically related to a person in the extended family that does have schizophrenia, then the risk is higher. And the chart below provides a rough estimate of that. This is information for teens to lower the risk for schizophrenia. Don't use street drugs and moderate in the use of alcohol. Make an ongoing effort to develop your social skills as such as you can. Avoid social isolation. Make an ongoing effort to maintain friendship with adults. Make an extra effort to learn positive perspectives on the world. Make extra effort to learn how to deal with stress and anxiety. Seek help from qualified psychologists and psychiatrists if you have problem coping.